Hello. Right, so I've been asking a lot for ideas and videos I should do, so I'm going to put that into practice, and I'm going to do a video today based on a suggestion from the Rooper123. Hello, the Rooper123. Hi Owen, why don't you talk about the NHS, junior doctors' contracts, removing of safeguards for working long hours, 7-day services, and its lack of funding? This might surprise you, but I have no sympathy for junior doctors. I mean, firstly, they crashed the economy in 2008. Do you remember that? That subprime mortgage scam they had running over in the United States. Blimey, I mean, they've still not apologised for that, and frankly, they should pay for it. It was obviously the bankers who plunged the economy into disaster in 2008, but it seems to me, ever since that happened, anyone but the bankers, the financial sector, the elite, have been expected to take a bit of a kicking.
Whoops.
But this government now is attacking junior doctors who took to the streets a few days ago. And what they're doing is this. They're imposing a new contract on junior doctors. Now, they're saying it's part of a 7-day National Health Service. Well, firstly, FYI, Jeremy Hunt, the Health Secretary, we already have a 7-day National Health Service. I don't know if people notice, but hospitals run on Saturdays and Sundays. Now, in terms of extending services for the NHS and making it so, well, you know, every single day you have a really good open National Health Service, that's a great idea, but it needs the actual funding and the actual resources. The NHS is now going through, and has gone through, the longest squeeze in its funding since its foundation in the 1940s. So if you're going to have ambitious new proposals for the NHS, you're going to actually have to fund them. On top of that, the government have introduced this programme of fragmentation, which is great for the private sector. They're hugely increasing private sector involvement. Yes, it began under New Labour, but the proposals of this government open the way for ever more fragmentation and greater privatisation of our National Health Service, stripping the national out of National Health Service. Also, cuts to local care services are putting strain on the NHS. We have an ageing population on top of that. So all of that together, our NHS is facing a mess. And that is a crisis that affects all of us. And at the same time, junior doctors are getting this kicking. So this new contract means that pay for junior doctors could fall by up to 30%. At the same time, they're expected to work far more hours. So what's going to happen is this. Usual working hours for junior doctors are going to be extended from 7 a.m. to 7 p.m. Monday to Friday to 7 a.m. to 10 p.m. Monday to Saturday. So on average, that adds over a day's worth, 28 hours worth extra every single week for junior doctors, whilst their pay is being slashed. Now, I don't know about you, but if that was imposed on me and I was already slogging my guts out, antisocial hours and all the rest, saving lives, looking after people's health, I would be pretty angry about my pay being butchered in that way and being expected on top of that to work far more hours. I think I would be livid about it, and I don't think a single person watching this would probably feel any differently. The British Medical Association last year found that 40% of doctors were suffering from low morale. On top of that, it was reported last year that half of all GPs wanted to quit the National Health Service over government cuts. Now, if we want to attract the best possible doctors to a National Health Service, treating them like this is not the way to go about it, and that's really bad for the NHS as a whole. Also, I don't know about you, but if I suffer or you suffer, and touch wood, this doesn't happen, but if you suffer a terrible accident, I don't think you want a junior doctor who's overstressed, who's been working ridiculously long hours at the end of a already monumentally big shift. Of course we don't want that to happen. So it's bad for the doctors, it's bad for our National Health Service, and it's bad for the patients as well. Now, our National Health Service should be one of the proudest institutions in this country, and this government keeps talking about patriotism, and they keep calling the leader of the opposition a threat to national security. I think if a foreign leader was speaking like that about the leader of the opposition in their country, we'd be pretty alarmed, but there we have it. But what is patriotic about undermining one of the proudest British institutions? And that's what they're doing.
Our plan is a service which will provide the best medical advice and treatment for everyone.
So my argument is this: the fight of junior doctors, it's all our fight. You know, we've all, I think, got a responsibility to support them. I'm glad they went out and protested. They do have the right to strike as long as it doesn't affect emergency care. Now, the last thing doctors want to do is go on strike. You become a doctor because you want to care for people, you want to look after them, you want to improve their health. And a strike is very much the last resort. I don't know about you, but if doctors decide to take that strike action because they've been so pushed into a corner, then I will back that strike action. And, you know, what I want to do myself is just urge people watching this. If, you know, your junior doctors are taking action, whether it be protests or anything else, go out and support them.
NHS, hear our call, make our contract safe for all.
The government need a hammering over this. It's a big issue, so I want to hear from you. What do you think we should do about both junior doctors, but also the general attack on our National Health Service? What, you know, maybe you've got experiences of care by junior doctors that you want to share, good examples which we can use, or, you know, maybe you're a junior doctor and you're affected, and I want to hear from you as well. So this is a really important issue. It's something I'm very passionate about. I hope you are as well. But I want to hear your thoughts. Subscribe as ever, and I will see you next time.